Hello, people from MedicReS. Um, my name is Nasi, and I will be presenting on behalf of Dr. Alberto MUNOZ, focusing on this topic, which is intelligent healthcare, feedback loop learning between human physiology and robotic agents. This is, of course, part of the International Congress on Artificial Intelligence Practice and Innovation in Health Sciences. This is a small outline of our presentation. Let me go forward. Okay. Dr. Alberto Munoz is a computer science full-time professor at Tecnológico de Monterrey, and he's the principal investigator of the robotics computing complex and intelligent interaction innovation systems, which is, of course, integrated by undergrad and graduate students as well. And well, firstly, I'll briefly talk about our startup company project, Healthcare and Robotics, whose main goal is to narrow the gap between healthcare and computer technology, artificial intelligence, and robotics. First off, one of our projects is to develop a non-invasive intelligent Parkinson's disease remote control system. This system includes various tools and equipment that anyone can use to improve their skills. For example, we're working on a device to control stability in glass grabbing. Since we're looking to develop an anonymous-based system, we have decided not to go for this type of design, but to use a different kind of approach in this case. For instance, we have looked for databases or for PD tremor data and also arm movement data, but it was very challenging. But it was a very challenging test because there are only a few public databases available on the internet. And well, this approach is trying to augment the data from those initial databases we got, and then using some kind of signal processing and recurrent neural networks, we obtain some binding for this type of data, augmenting our inputs to perform a concrete analysis of Parkinson's disease. Then, after collecting all this data, we plan to use it to develop a complete control that can be used in this case to control movement when trying to grab a glass or a cup of water, for example, and this is a reinforcement learning agent within the gymnasium library, which is aiming to control that tremor signals, representing this movement at the elbow joint and at the fixed joint in this double pendulum system, respectively. This is one of the plots of how this agent is learning to stabilize this typical movement data. And then expecting participation in the 2023 and 2024 Axonless Surgical Robotics Challenge, for which we have also decided to use a different approach to generate ground truth data from real operators and then train a robotic agent to mimic, imitate, and optimize these trajectories. This is an example of a trajectory that was achieved by one of our project collaborators. So the goal of this project is to assess how immersion in this simulator affects the performance of the surgeon, any kind of physician or an expert in surgery who's trying to manipulate this robot simulator via a haptic device. So after that, they provided us with this solution, which is to analyze the speeds and distances of these trajectories and then evaluate how well they were described in comparison to the previously achieved robot training. For that purpose, we are now training in Surgical Robotics Learning Environment, or SRO, which is a reinforcement learning tool for the Da Vinci Research Kit. That is to say, we're trying to use a simplified simulator since we found the AxonNet simulator a bit difficult to manipulate and to integrate with other technologies. So first of all, we're willing to train the agent in very controlled conditions and then use visual feedback to improve performance to finally transfer all this learning to the simulator proposed by the challenge. However, this project does not end with this challenge, as there is a great opportunity for this generation of VR enhanced data to create a system that can improve how physicians and surgeons perform surgery. So we are currently working on that kind of research. Then we go to graduate student research. This is the integration of biomechanical and machine learning for an intelligent simulator for the detection of knee injuries. This is a research case conducted by Diana Sofia Rosales, who's built a very interesting device to sense the sounds of the knee or knee crepitus to classify this data and extract some features from them. So after collecting some data from different subjects, the healthy subject data seems very different from the data of the patients with knee injury, which is the data of the examples we are seeing on this board. So there are many interesting approaches he will be studying and delving into in future work. Another project is the creation and evaluation of a cervical cancer diagnostic algorithm based on integrated machine learning techniques of cervicography images, which of course focuses on extracting data from DICOM images and then to have them available in databases so they can be analyzed, pre-processed, used to train an object recognition framework such as YOLO version 5, which is the example we're looking at here in this image, that in general tries to detect cancerous or tumorous tissue and improving how cervical cancer can be diagnosed earlier than usual. And while some of the experiments that Orlando Gonzalez is doing depend on increasing this small amount of data using different types of classic computer vision techniques such as filtering, like the Sobel filter or the Harris border detection filter. Then he will be using this augmented data to train different types of convolutional neural network models to get the diagnostic results. Then let's move on to one of the most collaborative research cases, and we'll talk about that later because it has some overlap with another project that our group is focused on these days, which is design of an ecological interface design of an imagined speech BCI. Well, there are a lot of language paradigms, so to speak, but for you to see here, this one is willing to understand how EEG data have different types of functions and how complex processes are represented. Subsequently, we have to analyze each ERP and the different profiles of the wave signals to get conclusive in our results. This is the traditional language paradigm, but now Edgar is willing to use this data and this novel paradigm to control a real robot. And well, this is a traditional, these are the classical words included in these kind of protocols, which are the go forward, go backward, go left, and go right comments. And then, as you can see, this is the paradigm routine program in OpenBite. And then this is just an example of how they were testing different subjects so they could get enough data to collect this amount of wave signals and EEG data, and then use it to train a model to identify and command robot movement. But that's still work in progress. Moving on, the last project we're going to review today is about a real-time brain-computer gaming controller through imaging speech comments. We have these EEG evoked potentials. We've got different information that can be used to train deep learning models, but it would depend on the type of model or method you are using to evaluate these results, what quality of predictions you will get. So to get some predictions or interesting predictions of what the subject is willing to say or willing to express in this case, Alma Cuevas here is aiming to train a diverse model set, that can evaluate these evoked potentials all together so they can generate a complete scenario of how these predictions are to be made. For example, one of the cases she has been trying first of all, is a standing game simulator for Pac-Man, the popular Pac-Man video game. And then using these three methods, the EEG-net, the recurrent neural network, and also support vector machine classifiers, she will tell, or our predictions will tell, if our data is good enough to be classified as a certain kind of prediction. In this case, we have the output prediction as left. So summing up all these scores from the different methods, we can get, of course, a good prediction of this data. And well, that's it for today. Don't hesitate to contact our research team if you want to reach me. You have my LinkedIn here, and I want to deeply thank MedicReS for the invitation and Tecnológico de Monterrey for supporting this research, and all of you for attending. Goodbye.